Hello, and welcome to today's webinar. We're happy you could join us. My name is Naya Hyde, and I'm the Marketing Assistant for K-12 Education Products at Brooks Publishing. Before we start, we'd like to go over a few housekeeping items. You'll be muted for the webinar, but if you have any questions during the presentation, please type them into the question box. We'll take these questions after the presentation during the Q&A portion of the webinar. For the presentation, you might want to minimize the GoToWebinar bar on your monitor so you can see more of your screen. You can do that by clicking the orange button with the arrow in the top corner of the control bar. If you need to enlarge the bar again to ask a question, you can just click the orange button again. If you experience any audio issues at any point, you can switch to phone by clicking in the audio section of the webinar panel and use the dial-in information provided. Also, we are recording this webinar. Everyone who registered for the event will receive a link to the recording in a follow-up email tomorrow. All live attendees will also receive their certificate of attendance in the follow-up email tomorrow as well. If you have any questions throughout the presentation, we encourage you to type them into the questions pane at the conclusion of the webinar. We will hold a brief Q&A. During the Q&A, we will try to address as many questions as we can. Next slide, please. Perfect. I'd also like to share that we're offering a 20% off discount on our products to the end of June. Anyone who watches this webinar or the recording can use the code COFFEETALK at checkout to receive the discount. If you like today's presentation and are looking for more professional development webinar opportunities over the coming weeks, be sure to visit the Brooks Publishing website for the latest additions to our Coffee Chat series. We're hosting chats every Monday, Wednesday, and Friday with our esteemed authors and would love for you to join us. Without further delay, I'm happy to introduce today's speaker. Dr. Elizabeth Peña is a professor in the School of Education at the University of California, Irvine. Her work focuses on differentiating language impairment from language difference in bilingual children. Her assessment work employs a variety of methods, including standardized and dynamic assessment. She is interested in how children from diverse linguistic backgrounds learn new language skills and how they lexicalize their conceptual knowledge across two languages, and has published extensively in these areas. She is a fellow of the American Speech, Language, and Hearing Association. Elizabeth, thank you so much for joining us today.
Thank you. Thanks for having me. So today I'm going to be talking about bilingual assessment with the particular question of what do we learn from testing kids in English? And this is prompted by some of the needs that we have in the field in terms of good assessment of children who are bilingual for the purpose of identifying language impairment or developmental language disability. Okay, so all along, oh, there we go. So these are, okay, for a moment there, I wasn't clicking through. Okay, so these are many of the languages that are spoken all over the world. And you can see that these languages also are spoken in the United States. And so we have a large immigrant population, about 20%, and in some cases, like in California, Texas, Florida, we have up to 40% of our children who speak languages other than English at home. And these include Spanish, Chinese, Tagalog, Korean. These are our top 20 languages spoken in the U.S. by the children that we're serving. Developmental language disorder is an often invisible disorder that affects all aspects of language, and it occurs about once in every 14 children, with approximately 10% once you start to consider children with disabilities in other areas that also affect language. So we're talking about a good portion of the population. This is a disability that is often invisible, and it's hard to diagnose because of its invisibility, and sometimes these children are missed. A big challenge in bilingual assessment for identification of language impairment is that often second language learning looks like developmental language disability. So when children are learning English, they make errors that are very much like errors that children with DLD will be making. Also in children's first language, as they're losing their first language and learning their second language, they may also make errors that look like developmental language disability. And so it's really difficult to tell whether children have a language impairment or whether they have a language difference. This is affected by issues around how much exposure they have to each of their languages, the percent, the age at which they learned their first language, and you might see different patterns of children's performance in each of their languages depending on what we're testing. So whether we're testing morphosyntax or vocabulary or narratives. And so these are all are issues that really affect whether or not we can do a good job at accurately identifying developmental language impairment or disorder in bilingual children. The other issue that I think is really critical is that in the US, only about 4 to 6% of SLPs are bilingual or have training in bilingualism. And so this means that a lot of us are having to make clinical decisions about kids when we don't necessarily know the other language. So I think that there's some things, though, that we can do that help us make these clinical decisions. And these often come up in terms of how, is this a difference or is this a disorder? Now, this doesn't mean that we shouldn't test in both languages when we can. And so I have done quite a lot of work demonstrating that we get our best classification accuracy when we can test in both languages. And so this doesn't erase that, but we can't always do that in every case. And so as much as possible, we want to use both languages. And so these are 3 examples of studies where we've done, where we've demonstrated that if we screen children in Spanish and English, for example, in the areas of morphosyntax and semantics, we get really good clinical accuracy when we combine both Spanish and English performance in children. We've found this in semantic tasks, and we've also found this in combining semantics, grammar, and narratives. And this is a paper that's going to be coming out hopefully this year. So we get our best results when we test in both languages, but it's not always possible to do that. So what can we learn when we test children in one language, and what are the limits of that? This is sensitivity and specificity information for the BESA, looking at 2 different looking at the semantic subtests. So this illustrates the point around testing in both and versus testing in one. So in this analysis, we tested children in English only, in Spanish only, and then combined Spanish and English. And you can see here that when we test children in English only, we do a pretty good job at age 4, okay job at age 5, a terrible job at age 6. And these are the transition periods as children are moving from knowing Spanish only to knowing English. So those 4-year-olds who we did a pretty good job with are probably kids who started out as being more English dominant. In Spanish, you see the same kind of thing, although we do a little bit of a better job as kids are a little bit older. But you can see that when we combine both Spanish and English semantics together and enter them into a discriminant analysis, that we get pretty good classification. So above 80% sensitivity, so we're identifying children with language impairment as having language impairment, and above 80% specificity, where we're accurately identifying children without language impairment as not having language impairment. But can we get information when we test in English? And the answer is yes, and it depends, right? And so it depends on a couple of things. It depends on children's level of experience in English. So we need to be looking at things like, when did they first start learning English? How many years of experience do they have with English language learning. And we also want to look at their current exposure. So how much they have English exposure in the moment also will help us to understand what we can expect in terms of children's performance. The other thing that matters is what we test. So not all our measures that work for children at age 5 or age 6 for English only speakers are going to work in the same way for children who only have 1 or 2 years of experience in English. So I want to talk a little bit more of on each of those things. So first I want to talk about experience in the L2. We did a study, and this is published in JSLHR, and the citation is in the lower right-hand corner, where we tested children who had 1 year of experience in English, and they had 30% or more exposure to English in their day-to-day interactions across school and across home. And we tested them when they were in 1st grade. On the test of narrative language, using a cut point of 6, so that's 1 1/3 standard deviations below the mean, we had 78% sensitivity and 86% specificity. So we're doing pretty well with the TNL under these conditions. So using a cut point of 6 rather than a cut point of 7, which is what you would normally use on the TNL. Using, at least this is with the first TNL, not the revised TNL. I think the revised TNL, the cut point has moved up. And these are children who had at least 1 year of experience and were using English 30% of the time or more. You can see that, for example, vocabulary, that ROC over here, the green line, is pretty flat. We're not doing a very good job of using vocabulary in English to differentiate children with and without language impairment. Our best measure on this was the narrative measure, and we did a pretty good job. Grammar was okay, but not great. So you can see here where we tried different kinds of measures, and our best measure for 1st graders at this age with these conditions was the TNL. This is another measure where we use the BESA screener that we're calling the BESOS. It's still in development, but we did this measure with about 1,000 children. And we looked at different levels of English exposure. So our FME kids, those are functional monolingual English speakers. These are children who have 20 exposure to Spanish or less, 80% exposure to English or more. And you can see that we have clear differentiation between their performance in morphosyntax and semantics, between children with risk for DLD and without risk for DLD. For the bilingual English dominant kids, we also have clear differences, but the cut points are going to be a little bit less. But the amount of difference between children with risk and without risk is pretty consistent. That you can see that we need to start, that we would use a slightly different cut point for children who are bilingual English dominant. And these are children who have between 60 and 80% daily exposure to English, and 40 to 20% daily exposure to Spanish. For our balanced bilingual kids, you start to see the same kind of thing, but they're even lower, and so our cut point would move to in between the risk and the non-risk kids. So you can see that depending on how much exposure they have to each of the 2 languages, we would move the cut point along in terms of making that clinical decision to identify risk. On the other hand, our bilingual Spanish dominant kids and our functional monolingual Spanish speakers, there are differences between kids with and without risk, but those differences are not large enough to probably make a good clinical decision. So for them, we would need to combine Spanish for them. And this comes from a paper that we published in AJSLP. I think it's a 2013 paper. The other thing that's different is what we test. So one of the things that we've been working on is this question of, if we test in English, what can we get? So we went back into the data, item level data from the BESA, and we looked at how children performed in English at these different levels of English exposure. So our dominant English speaking kids are children who are using English 60% or more of the time, so 60% to 100% of the time. Our balanced bilinguals are children who are using English between 40 and 60% of the time, with an average of 50-50. And our Spanish dominant children are children who are using Spanish 60 to 100% of the time. So what we were really interested in is whether we could get good information out of English testing, because I think that that has implications for whether we can build a test that clinicians can use in English. So let me tell you a little bit about what these numbers mean. These are item difficulty levels, and they're averaged across all the passive forms, for example, or all the third singular forms. So there's 3 or 4 of each of these items that we average together. So an item difficulty of 0.92 means that it's easy for English dominant children who are typically developing. So most kids should master that, and these are children between 7 and 9 years old. Children with DLD, however, are at 50%, and so this item differentiates children with and without DLD. And you want to have differences that are at least 30% for it to be a reliable difference between children with and without DLD. So you can see that passives, for example, differentiate TD and DLD kids who are English dominant, but it also does a pretty good job, not a great job, for balanced bilinguals. But for balanced bilinguals, it's a really hard item type. And for Spanish dominant, we also see that we have reliable differences between children with and without language impairment. And again, it's much harder for typically developing kids who are Spanish dominant. But the passive form is one where we might see typical kids doing it not super accurately, but children with DLD doing it even less accurately if you give this item in English. The third singular, you see the same kind of pattern, and these 4 item types in English are items that seem to work across the board, even though they're much harder for children who are not English dominant to do. The children who have DLD, it's even harder for them. So those items help us to make this distinction. For this next set of items, these items work only for English dominant and balanced bilinguals, but it doesn't work to distinguish children who are Spanish dominant. And then over here, the negative, the copula, and the relative clause are too easy for the English dominant kids, but these are working for the balanced bilinguals and the Spanish dominant kids. And then irregular past only works for the English dominant kids. So this is much too difficult for our balanced bilinguals or our Spanish dominant kids. So the story here is what we test is also going to make a difference in terms of helping us to make clinical decisions about children with and without language impairment. This is a similar set of data, but this is looking at item by a bunch of different items of different types in the semantics domain. And so we have items that are association items. And so those are items that are things like, tell me a word that goes with cup. Tell me another word that goes, you could say coffee. Tell me another word that goes with cup. And so you are looking at those semantic relationships in children. So, and I think a lot of these other ones are pretty self-explanatory characteristics, or tell me 3 things, or tell me 2 things about this girl or this person. And so you can see that we have some distinctions between children with typical development and DLD. on some of these items for children who have high Spanish exposure. And these are kids who have high English exposure. So these are still hard for kids who are typically developing, but there are some reliable differences. So we don't expect children who are typically developing and Spanish dominant to be able to do these forms perfectly, but we do see patterns of difference between children with and without language impairment. As we move into children who are more balanced bilingual, you can see that they can do items at a little bit of a higher level, and there's some items that they can do that the Spanish dominant children can't do. And then if you move into high English exposure kids, so again, children who have 60% or more exposure to English, there's items that they can do that overlap and don't overlap with our other two dominance groups. But here, the story is we need to develop items specific to each group of children, and by pulling those items together, maybe we can get to the point of being able to make reliable clinical decisions about them. Summarizing the data for the the grammar part of this, we find that when we tailor items specifically for English dominant kids, balanced bilinguals, or Spanish dominant kids, we can get pretty good sensitivity and specificity when we tailor specific items. But this is not the same as just renorming the test, because you can see that, for example, the items for English dominant kids don't work very well for the balanced bilinguals or for the Spanish dominant kids. So we have good sensitivity for the Spanish dominant kids because we over-identified kids who didn't have language impairment. So specificity is only 44%. But over here, when we pick the specific items that worked for the Spanish dominant kids, then we got really good sensitivity and specificity. So this speaks to the what we test kind of a approach. So I think that we want to look at both children's level of exposure, and then given that level of exposure, tailor testing or tailor assessments to the kinds of things that we would expect children to do at that level. And these papers give you some ideas of what we might look at, for example, in language sampling or even on standardized tests, even if we use them as criteria and reference measures. So I'm happy to take questions now. I think I may have gone a little bit over, but we have a few minutes for questions.
Perfect. Wonderful presentation, Liz. And thank you again, everyone, for submitting questions. Let's jump right into it. And just a quick reminder to anyone with questions, be sure to enter them in the questions pane now. So we got a lot of great questions. I'll start with this one. How can we fairly assess language ability in bilingual Spanish-English speakers very low in Spanish or not fully developed in English, especially when they're uncomfortable with Spanish expressive language testing?
That's a really great question. Even though we find that at the group level, children when they're in that transition, that they're low in both, typically. At the individual level, we're really finding that children show stronger performance in one language or another. So I think that one of the things that we need to do is, if at all possible, test in both languages and then compare performance in each and use their better performance. Sometimes, though, in that transition, what we found a lot is that children are starting to master, say, semantics in English, and their semantic scores are better in English than they are in Spanish. But if you look at grammar, their grammar is still much better in Spanish than it is in English. And so that's sometimes a little bit puzzling, because you think, well, if they're dominant in semantics in English, maybe they should be dominant in morphosyntax in English, and they're not. And so we have to also combine across domains to get a big picture of what children are able to do.
Awesome, great response. We got another question. It says, what are the most crucial steps to take for beginner clinicians seeking to become bilingual SLPs?
I think that you want to, that's a great question. And I think that you want to learn about first and second language acquisition. I think that's going to be really critical. I think the fluency in another language is important, but knowing another language doesn't, just like knowing English doesn't make you an SLP, knowing another language doesn't make you a bilingual SLP. And so I think that it's really important to develop the knowledge base about what does first language acquisition look like, what does normal second language acquisition look like, what are markers of language disabilities across different languages, how do we differentiate difference and disorder, what are things that can transfer between languages, what are things that are hard to transfer between languages. So we really need to build those skills, and that knowledge base is going to be really important. There's workshops, there's specialized programs with this, with bilingualism in mind, and I think you can gain that also through things like journal clubs, reading. There's a lot more information out there about bilingualism. Thanks for that question.
Yeah, those are some great steps. Another question we got from one of our attendees is, where can I find information about language acquisition differences between English and Spanish? For example, in Spanish, children learning commands first versus in English, children learning names of objects first.
That's a really good question. I think that some of that is in the literature, and I don't know of any one place where it's all compiled, although there are there are a couple of really good books. I think Brian Goldstein has a book on bilingual speech and language acquisition and disorders. Joanne Paradis has also a really nice book looking at bilingual development and disabilities, and Kathy Conert, I don't know, did she ever revise her book? But she had a fabulous book on this. But I think a lot of this information is in the literature, but it's pretty scattered. Our textbooks, of course, are books that help us pull that information together.
Perfect. That's a great response, because we had a lot of people asking if you had any book recommendations. So great response. And then we have one last question before we wrap it up here. Someone asked, is it important for child care providers birth to 5 years of age to screen children with both English and first language tools to determine if a referral is needed?
Oh, I mean, it's hard to know, right? I mean, I think that screening tools are really helpful, and if they're reliable, they do a pretty good job of flagging children who might be at risk for DLD. And I think if we do that, we get our most reliable results if we screen their home language as well as English. It's really hard to predict whether or not children are going to, we did these big screening studies where we've done 2 or 3 of them now where we screened over 1,000 children. And it's really hard to know, even when you look at children's exposure, there's always a few kids who look like, oh, they're really English dominant, but they turn out to be better in Spanish on something. Or they're really Spanish dominant, but they turn out to be better in English on something else. So I think it is really important to use validated, reliable, accurate tools. So you always want to look at their sensitivity and their specificity. And for screening, you want to have high sensitivity. Specificity may not be quite as important. You don't want to have to follow up on too many kids, but sensitivity is going to be really the thing you want to go to first. And you want to try to do it in both languages as much as possible.
Well, thank you for all your responses. And again, thank you everyone who attended today. We really appreciate you spending your time with us. And that was a great webinar, Dr. Elizabeth Peña. We really appreciate you being here today.
Thank you. It's been a pleasure.
All right. Thanks, everyone. Have a good afternoon.